When it comes to complex care, most dentists think patients say yes because they understand the clinical need. But the truth is this: patients don't buy treatment, they buy outcomes. And the higher the clinical complexity, the more emotionally and financially significant the decision. Patients need to believe three things before they say yes. They need to feel understood, they need to believe you can help them, and they need enough trust to follow your leadership. These three conditions aren't nice to have. They're essential, especially for complex care, because complex care treatment requires more time, more decisions, more resources, and ultimately more confidence. Without these three elements, even the most well-reasoned treatment plan can stall. First, patients need to feel understood. Complex care begins with the patient's story, not your diagnosis. Before patients can commit to significant treatment, they need to know you understand how their dental condition gets in the way of their life. Next, you need to understand the lifestyle benefit they seek and how treatment needs to fit into their life circumstances. When patients feel understood, two things happen. Their anxiety lowers and their openness to solutions increases. This emotional alignment is the foundation of complex care treatment acceptance. Patients aren't just listening for what's wrong, they're listening for whether you get them. And when they feel understood, they're far more willing to move forward with treatment that improves their life, not just their teeth. The second thing patients need is to believe that you can help them get what they want. Once patients feel understood, they naturally want to know if you can deliver the results they care about. The lifestyle benefits of comfort, aesthetics, function, confidence, and longevity. Complex care acceptance isn't about explaining procedures. It's about connecting your clinical plan to their desired lifestyle. When you present treatment as a pathway to what they personally want, everything shifts. Treatment stops feeling like dentistry and it starts feeling like progress. The third thing patients need is to trust you. Now, this is the big one: trust. Complex care requires patients to make decisions they can't evaluate on their own. They must trust your expertise, your process, your intentions. So how do you create trust? It's not by heavy doses of patient education. You've probably already figured that one out. You create trust through speaking with calm confidence instead of clinical intensity. You slow down to prevent them from feeling overwhelmed. You guide the financial conversation instead of avoiding it. You reassure them that they don't have to decide everything at once. Patients follow dentists who make them feel safe and understood, especially when choosing complex care. When you lead with empathy and confidence, patients don't just accept treatment, they feel relief in having someone they trust guiding them. Complex care acceptance isn't about the perfect clinical explanation. It's about meeting those three human needs. When patients feel understood, believe that you can help them, and trust your leadership, they move forward not reluctantly, but confidently.